Actress Olivia Munn has been really open about her personal breast cancer journey. She also shared her mom's diagnosis with breast cancer. Olivia highlighted the lifetime risk assessment test that she and her mom took that she says helped save their lives with early detection. So what in the heck is this test and how does it work? I think a lot of us have questions. That's why I asked Dr. Payal Kohli to come in and talk about it. And because I think many of us would like to know, sometimes you don't want to know, but what is this test and what does it tell us?
The concept is completely novel. So the way we think about cancer screening is a snapshot, right? You get your mammogram, you get your colonoscopy, it's a snapshot in time. But this is actually looking at the whole course of your entire life. So even if you're a young woman in your 30s and 40s, what is your lifetime risk of cancer, for breast cancer, for colon cancer, for lung cancer? So it's a way of modeling and sort of a more sophisticated way of really trying to understand what happens. It's not just that snapshot. It focuses on many different cancers. It looks over the course of your entire life, and it incorporates many different risk factors. So I think it's a better way of sort of predicting the future.
And once you complete that test, for example, and let's say you score, I'm sure the higher the number, right, the more at risk you would be of developing breast cancer, what would you then want to do? Would you want to have more screenings or MRIs? I know you and I have talked about this separately.
Yeah, so that's exactly right. In Olivia Munn's case, that's exactly what happened. She had a negative mammogram, a high lifetime risk on that calculator, and then she ended up having more screenings, which is what picked up her cancer. So you do a few different things. The first thing you would do is more aggressive preventive screenings for yourself, right? Because you have a target sign on you. I call it a target sign. It puts target signs on people. When they're young, cancer is a disease of aging. You don't think of somebody as being high risk, but if they are, you think of screening them more aggressively. You also start to institute changes and risk factor modification that can actually change the trajectory of the disease. So even that lifetime risk assessment is not a static thing. It's a changing thing, depending on your weight, depending on whether you smoke, depending on whether someone else in your family develops cancer. All of that changes. So you start to think about more intensive lifestyle modification, and then you start screening family members. So if your lifetime risk of a cancer, breast cancer, for example, or colon cancer is high, I would think about screening your family members more aggressively and calculating their lifetime risk as well.
Talk about how it's calculated and what are the downsides? Like you would make your own, like going to Dr. Google, which everybody tells us don't do.
Yeah, so there are calculators online for breast cancer. For example, you can calculate yourself. Okay. Always want to do it in consultation with the doctor. And the way that it's calculated is we look at the prevalence of the disease in the population. So we say how much breast cancer or colon cancer, whatever cancer is out there, what types of people are affected. That kind of goes baseline into the model. The second layer is your genetics, your age, your family history, your health, your other conditions that could affect your cancer risk, like radiation or exposures or whatever. Layer that on there. Then you kind of put it all into a computer model that spits out a probability of you getting cancer. Now keep in mind, this is a probability, it's a guess, right? It's not 100% accurate. So you can have high probability people who never go on to get cancer, and you can have low probability people who do end up getting cancer. So you don't want to let this fake you out. You also don't want to let this make you hysterical and not live your life. But this is really a way for us to be smarter than the disease by predicting what it's going to do.
And what are some of the limitations with the lifetime screenings?
So the first is the biggest, most important. You want to make sure that you don't, turn your eye away from it if your score is low. Okay. The second is you want to make sure that you keep iterating it. So as your life changes, you change, your risk factors change, you want to be sure you keep calculating. A lot of people say, "Oop, I'm low, I'm done, I don't need to think about it again." It's something that should actually be done every year. And I'm actually really excited about the future of cancer screening, which is going to incorporate not just, the inputs we put in, but actually collecting your wearables data, looking at your genomics and your genetics, putting all of that in there, using AI to continue to iterate the model. Because as you know, cancer is not a static thing in our society. We're seeing more younger people with cancer, we're seeing more environmental exposures. And so all of that needs to go into the model so it keeps changing, so that we're not using a model that was developed 10 years ago to calculate your risk, but actually one that's being, ongoing.
And I know we're out of time, but would insurance possibly cover this?
So this is my big Achilles heel, and this is why I want you to talk to your policymakers and vote the way that would allow coverage, because right now nothing's covered. Only very high-risk people have genetic counseling covered, but many of the modeling that's required can be expensive. So for many of us, I would say all of us at this table, every woman listening and every man, you go out there and use those calculators, calculate your risk, talk to your doctor. Because a lot of things that go into the calculator are just things like family history, your age, when you start
your period. Which everybody can kind of figure that out.
Right. So you don't necessarily have to go through insurance. Talk to your doctor about how you can do sort of the poor man's way. There are self-pay options as well where companies will do it. Don't start doing that yet until you talk to your physician first. But calculate your lifetime risk, breast cancer, colon cancer, lung cancer, all of those.
Thank
Great.
you.
I
Had to
know.
get that in there. Thank you.